Good day, everybody. So my name is Anthony Moore, and I'm here with Dr. Penner, the Medical Director for Nisga'a Valley Health Authority, and we are here to provide a verbal update on why we are moving to extend the current gatherings and events notice to the current notice that was posted last week, and not moving towards the easing of restrictions that the province has done. So at this point, I'd like to ask Dr. Penner if you can provide us with an update from Nisga'a Valley Health Authority. Dr. Penner?
Thanks, Anthony. Good day, everyone. So to start with, just to give a bit of the background for where we're at with new COVID infections in the Valley, and how it's different from the rest of the province. What we've seen throughout the pandemic is we often get hit by COVID a bit later than the southern part of the province. All the northern health region gets hit a bit later with COVID, and then Nisga'a Valley itself gets hit even later than Northern Health. So we lag behind a bit. And same with our recovery. So when the rest of the province cases are declining sharply, the Northern Health is a few weeks later than that, and we're often a bit behind that. So we've seen that again with the Omicron wave, where there's a sharp peak all over the province, and really at the beginning of January, so more than 2 months ago, is when the BC new cases in BC started to drop off. Whereas the Northern Health region, it was a couple weeks later than that. So it wasn't until mid-January where cases in Northern Health region started to decrease. And then for us, it was actually just about mid-February. So really a month later than the Northern Health region, and a month and a half later than the province, that our COVID cases started to decrease. And that's why initially when the entire province reopened, the Nisga'a Nation didn't, because we hadn't reached that drop in cases yet. We were actually still just getting to our peak in high number of new infections. And then over the past 2 or 3 weeks, we have had a drop, and then it's just leveled out. So we're still not getting really a sharp decrease in cases like other areas. And to put some numbers to that, so since Christmas, we've had 149 new infections that we know about in the Valley, but actually 101 of those are just in the past 4 weeks. So really most of our new infections are pretty recent. And as things reopen in the rest of the province, we're also seeing the positivity rate. So the proportion of tests that are positive is actually starting to increase in BC in the last few days. So the number of new infections hasn't increased yet, but it means that probably the number of new infections is going to start to level off. It won't drop down to as low as it had before the Omicron wave. And that's just because more infections can keep going on with fewer restrictions. So we may also see the same thing, or that's probably why we're also seeing a leveling off in the Valley. We share really the risks with Terrace and the surrounding area, because we have a lot of people going in and out to Terrace. So when COVID rates increase in Terrace, then soon afterwards we get increasing rates in the Valley. And when the restrictions in Terrace got lifted and there were more events, then we're also sharing that risk, even though we haven't lifted restrictions yet. other factors that are probably contributing to why our cases have leveled off instead of decreasing to almost nothing is the recent sporting events. So basketball tournaments and stuff, we're seeing more young people getting COVID now. And it's usually pretty mild infection because these are young, healthy people. Most of them are, or all of them are vaccinated. There's also more gatherings recently. But another factor is that people are sort of taking their COVID symptoms less seriously, or at least some people are. So we may feel like, oh, it's just a little cold or a cough or runny nose, and not think much about it. So instead of staying home like we might have a year ago, people are actually going to work or going to gatherings with these minor symptoms. And the real danger with that is it's not really for the young people or the people with minor symptoms, but it's then COVID can spread to the next person, and then that person takes it to their home. And it's at home where we have sort of vulnerable household members. There's elders, there's people with multiple medical conditions, people who are unvaccinated in the household. So that's the concern. If Omicron keeps circulating, for most people, it's a pretty minor thing, but it will hit some of the people where it does become a serious illness. And so really that's the context, that we haven't seen that same big decrease in cases that the rest of the province has. We're certainly not at our peak anymore, but it hasn't dropped off so much that we feel it's wise to open up completely right at the moment. And with that, I'll pass it back to you, Anthony, about what the current restrictions look like.
Thank you, Dr. Penner, for your update, and hopefully that answers a lot of questions that people may have on why we aren't moving as fast as the province is for easing of restrictions. And it's kind of been that way throughout this entire pandemic for us. We've always had a lagging response because of our resources are so much less than what some of the larger municipalities have. We need to be more cognizant of our capabilities. So really appreciate your update. And when it comes to the Emergency Preparedness Committee and the COVID restrictions and how they are affecting us, our priority has always been the safety and protection of our elders and our most vulnerable citizens and residents. So it is prudent for us to delay the lifting of restrictions until further notice. We don't have a specific date at this point because the specific action that we're looking for is not predictable at this point. So the gatherings and events notice, when it comes to social gatherings and indoor organized events, it will be continuing. So what that means is we are at 50% capacity for events that are planned and organized. And those organizers are still required to fill out a COVID safety plan. And each village government has a template of this available to provide to each of the organizers. So for example, for the memorials and settlement feasts that are occurring, the WILP needs to designate somebody to be able to fill this out on what their family plans to do to help keep participants safe for attending their event. And this needs to be available at the event as well. And this is the same for any of the basketball tournaments or play days or social events that typically occur within the Nass Valley here. In addition to that, one of the things that we would like to stress is the proof of vaccination. So there are two examples of what the vaccination passports look like. And a majority of people have them now. It's the province's vaccine passport, which is the QR code with the green background, or there's the federal version that is typically accepted for going through airports as well. So there's the provincial version and the federal version. And every person that's over the age of 12 requires a passport to access any of the events that are going on. And the Nisga'a Guardians, who you would have seen at these events wearing the blue shirts and the black and the green high vis jackets, are there to help screen participants attending any of these events, so that we can make sure that all the attendees have had both vaccinations or triple vaxxed, and also that they're checking for your temperature, if you have any of the larger, more predominant symptoms of any of the COVID variants, that you would be denied access. If you have a partial vaccine passport, so the blue one, you will also be denied access to these events. And one of the main things that we want to stress is the mask requirements in public indoor settings. So there are a couple exemptions from this that we also follow, that are mandated from the province. So people with health conditions or physical, cognitive, or mental impairments who cannot wear one, people who cannot remove the mask on their own, as well as children under the age of 12. So other than those exemptions, you are required to wear a mask for all indoor settings. And the times that you can take them off are when, for example, you have at a feast, obviously when you're eating or drinking, but once that portion is complete, we're asking that you continue to wear your mask throughout the remainder of the event itself. And also, when it comes to other events that are occurring, such as any flow-through events where you would be just picking something up really quick, or like a dial meal or a catering event, that the mask is still required, and that you hand sanitize upon entering the facility. Our guardians will be cleaning those areas, those high frequently touched areas, as often as possible, as well. That we ask that the attendees try to do the same. So hopefully this gives each of you a broad idea of what we are going to be utilizing until the foreseeable future. As you heard earlier, we're looking for a very specific trigger to be able to increase the capacity of social gatherings within Nisga'a lands. And until that happens, the gatherings and events will be restricted to 50% capacity. And that the Guardians will be continuing even beyond the easing of restrictions. So you will see them if and when we do get to 100% capacity, similar to the rest of the province. And they will still be enforcing the proof of vaccination as well as the mask mandate. So they are here to help and ensure the safety of everybody that's attending, and that that we are doing anything and everything possible to ensure that the event is as safe as it can be, so that we can continue to build into the normalcy of our culture and our practices. So hopefully This gives you a good idea of what we are looking to do over the next few weeks. So, if there's anything else that you may wish to add, Dr. Penner, any other frequently asked questions that your department may have received,
just the availability of rapid at-home tests, because we and village governments get a lot of questions for that. So we do have a large supply of rapid tests available, and we have them at all the health centers, so they're in every village. We're still following the BC CDC guidelines on who should be using the rapid tests. And so right now, it's basically anyone who has symptoms of possible COVID, even if minor. So any, runny nose, sore throat, cough, fever, stomach upset, feeling unwell, anything like that. If you have any symptoms at all, then you can contact the health center, and you'll be provided with rapid tests that you can do at home. There's instructions with the rapid test, and there's also a link on our Facebook page with YouTube, like a YouTube video link on how to do them. Some people find them difficult to do on themselves, so you can get help from someone else. But right now there's no limit for availability of rapid tests. In order to sort of preserve our workforce, we're only distributing them weekdays, so Monday to Friday during working hours. We don't consider a COVID test an emergency, so we're not asking our staff to come in after hours or weekends in order to make a COVID test available. If it is after hours or a weekend and you think you need a test, then basically you should just assume you have COVID, isolate, and then get the test at the next available time. If you're having trouble breathing or any health concern, then that may be emergency, and that's different. Then you should call the emergency line and be assessed by the nurse or the doctor. But if it's just for a rapid test, we'll do that working hours, Monday to Friday.
The gatherings and events notice does not affect any of the government work that needs to go on. So any NLG, school district, as well as any of the NVHA gatherings that need to occur. There's large planning meetings and stuff that are not affected by these particular orders. In addition to that, one of the huge questions that we receive is if the one person in the household receives a positive result, we are asking, and that in most cases that the entire household plan to isolate, just so that we can slow the spread as quickly as possible. Even if you're not feeling any symptoms, there are avenues available if the isolation is not possible as well. And I believe you call NVHA or First Nations Health Authority for any additional supports to be able to isolate, say in Terrace at any accommodations out there, such as a hotel. And this is a huge request by the members of the Emergency Preparedness Committee. We are really hoping that the general public that reside within the Nass Valley are on board with this plan for us, so that we can begin working towards the easing of restrictions as the rest of the province. and that when you are screened at these events, that you just show a little patience and understanding for the work that the Guardians are doing. It's not an easy job to do the work that they are doing, and every day is a learning opportunity for each of us to be able to ensure that we're doing everything that we can to ensure the safety of everybody. So similar to last week when we extended the communique that was supported by each of the chief counselors and our senior officers of Nisga'a Systems government, this extension will be, as I mentioned earlier, does not have a specific date. So we will be meeting weekly as an emergency preparedness committee to go over the current infection rates as well as the current trends, and using that information as well as many other information to determine whether we feel it's safe enough to move into the easing of restrictions. So hopefully this video will provide you with some rationale as to why we are not moving as quickly as the rest of the province towards the easing of restrictions, and how we can ensure the safety of everybody at these events, as every event is different, right? And we want to make sure that the Guardians are aware of these events so that they can make themselves available. With that, if you don't have anything further, Dr. Penner, I want to thank the communications department for organizing this and helping provide this update for the Nisga'a Nation. So with that, thank you very much, everybody.